In this video, you will understand the variety of treatment options of varicose veins, home care for varicose veins, how to prevent them. Varicose veins are a problem affecting the veins of the legs. The leg veins function in circulating blood back to the heart. When an individual has varicose veins, the veins do not work well, causing the blood to pool in the lower legs and feet. Symptoms include heavy, tired or achy legs and in severe cases, skin discoloration and sores. The initial evaluation includes taking a history and performing a physical examination. A duplex scan, a type of ultrasound, is the most common and preferred test to evaluate the vascular system. A duplex scan is performed by a vascular technologist and allows doctors to look at the blood flow within veins. This is a painless test performed with a probe and the application of gel. This test is not needed in all patients, especially when there are no symptoms or they are mild. Laboratory blood tests are not needed in patients with varicose veins unless they have ulcers or a history of phlebitis or deep vein thrombosis. Compression stockings typically apply an external pressure of 20 to 30 millimeters of mercury to the leg. These special socks that fit tightly over the legs and ankle can be used for symptom relief. For patients with varicose veins resulting from clots in the large, deep veins, post-thrombotic syndrome, or patients with skin ulcers, stockings applying 30 to 40 millimeters of mercury of pressure are preferred. These stockings are available over the counter or by physician prescription. Most patients require the stockings for some time, so it is best if they are custom fit based on leg size. For patients with varicose veins resulting from blood moving backward because of incompetent leg vein, saphenous reflux, compression therapy is not sufficient as the only treatment. Other therapies include microphlebectomy. Small incisions are made in the skin, allowing for the removal of varicose veins just below the skin surface. Sclerotherapy. A solution is injected into the vein, causing it to scar down and visibly fade. This therapy is recommended for telangiectasia, reticular veins, or small varicose veins. Radiofrequency ablation or endovenous laser ablation. This outpatient procedure is the preferred treatment for saphenous reflux because of shorter recovery and less pain compared with removing the vein. The vein is heated with a catheter inserted into the vein with the patient under local anesthesia. Heat is used to destroy the vein and the vein quickly disappears. Microphlebectomy is sometimes required as a second stage of treatment weeks to months later. Vein stripping surgery. This operation is performed in the operating room but does not require a hospital stay. The surgeon makes small incisions in the groin area and below the knee to remove the major culprit vein connecting these two areas. After the operation, patients require compression stockings and may need microphlebectomy of other veins, preferably performed during the same visit or in a subsequent visit. Not everyone with varicose veins may need a procedure. Many of them are simple things a person can begin immediately. To get relief, for example, elevate the legs as much as possible. It is important to raise the legs up above the level of the heart to get the maximum effect and to do this for about half an hour each time. Wear compression stockings. The key is to put them on in the morning before walking around and before the veins become more swollen. If you try them and experience worsening pain, especially after walking, remove them and see a healthcare professional. You may have problems with the blood supply to the legs. If you are overweight, try to lose weight. Eat a healthy diet high in fiber, low in fat, and low in salt. Avoid alcohol, which can cause the veins in the legs to dilate. See a healthcare professional if you have health problems such as chronic constipation, urinary retention, or chronic cough. Relieving conditions that are causes of straining may help with the varicose veins. Avoid wearing tight clothing such as girdles or belts. Do not cross your legs when sitting. Walking is good exercise and it can help the muscles force the blood out of the deeper vein system. If you are driving on a trip, traveling by air for a long period of time, or working at a desk all day, try to get up and walk around every hour or so to allow the muscles to pump the blood out of the veins. You may not be able to prevent varicose veins. You can reduce your chances of developing them by living an active, healthy lifestyle. Healthcare providers recommend many of the same measures to prevent and treat varicose veins. Avoid long periods of standing, elevate your legs, maintain a healthy weight, quit smoking and tobacco intake, staying active, try compression stockings, wear clothes that fit properly. This video explains the variety of treatment options of varicose veins. The self-care you take for varicose veins. Also explained are the measures that one can take to prevent varicose and spider veins.